I'm an adventurous and I wanted to travel all over the world. I learned about the United States through the books and movies. I admire the movie stars and I picture this country as a heaven. When I first moved to the United States, I lived in Chicago. A lot of things in this big country were strange to me. I did not know how to use a refrigerator. I did not know how to order food. I did not know how to answer people. I had no warm clothes and I did not know it would be that cold here. For a long time, I used to keep my money in my locker at my job. One day, my boss knew about it and advised me to put it in a bank. I did not know that. These stories seem little things, but those are the things that you have to cope with in your daily life as a new immigrant. And I've been very fortunate to meet a lot of nice and kind people. They offered me the help during my early immigration struggle. But I'm glad I could speak English back then. How could I receive help if I have no English skill? Later, through my jobs at the Naval Medical Hospital and my volunteer work, I have the opportunities to see a lot of new immigrants struggling for their daily lives. That's why I've decided to help the people whatever I could.
This girl has the ball. The girl has the ball in her hand. This girl.
Language barrier is one of the major issues faced by the new immigrants. When you don't know English well, it's harder to adjust to the new environment. It is especially hard for elders who don't go back to school and stay in their community all the time. So I really encourage people to learn English to help improve their life and the ability to participate in the community here. It is true that if you don't talk English much, well, there are some resources in Chinese, Hindi, Korean, Vietnamese, and maybe in some other Asian languages. But often the resources still consider Asian as a whole group and don't address a specific problem for specific communities.
This is like V and R.
ကျေးဇူးတင်ပါတယ်။ဒါရောက်ပြီးဈေးရောက်ကြပေးတဲ့ညီကိုမောင်နှမမိဘမောင်ဝအားလုံးကျေးဇူးတင်ပါတယ်။ကျွန်တော်တို့စတင်ပြီး The Sky တေဂီတာဖွဲ့ရဲ့လက်စွမ်းများကို
Even when they speak and understand English, people are sometimes scared to ask for help, afraid of being a burden for others, and sometimes it can block their access to healthcare information. Let me give you an example. I have here some Burmese friends whom I know from Burma, educated people. When their parents came to the United States, they could not afford health insurance for them. One day, the mother-in-law had a heart attack. They thought it was indigestion, so they all helped pressing on her chest. But of course, that made the situation worse. Finally, she was taken to the hospital and died shortly after. It is sad, but since my friends could not afford the health insurance for the parent, they didn't bring the mother to see the doctor when she had problems before. They didn't know about the programs supporting people who live in the county and who have low income and are simply not insured. They should have called, asked for help and support. I really feel for my fellow Burmese people who are new immigrants, as I've also gone through some hard times when I arrived in this country. As much as I can, I will help spread the information about the services that are available for my people and for other Asian community members. Son for days. The man died in the year 1543. The man said, I must write a book. Okay?
A little part.
Well, see, after you read this over different things, you will understand. You won't understand everything at the same time.